Welcome to this course by Brilliant Birth Academy on the therapeutic range of essential oil use in birth. Many safety sources and people who sell oils, multi-level market distributors will say oil use is safe. And you have, obviously, they're generally recognized as safe. There's this incredible body of evidence that, essential oils, even in birth and for use with sensitive populations, is safe. We have a very small number of adverse reactions that we see happening. And yet, there's this overwhelming narrative coming out of the birth community that a lot of mothers, even experienced oil using mothers, were using oils in birth and were having what seemed to be a higher level of adverse reaction than in just normal use. And so that really started our team down a journey of examining the therapeutic range of essential oil use in birth. And this course and the material of this course really is a cornerstone of why this program exists. And so we're really thankful to be able to present this information for you. And we hope that it can be, this course is the product of an incredible amount of listening. And we hope that it will spark an incredible amount of conversation. So let's look at when we say a therapeutic range, what does that mean? So in aromatherapy dosing guidelines, a therapeutic range of oil use is the dose range of an oil that is high enough to be effective and low enough to be safe. For the purposes of this course, we are just looking at safe oil use as that which does not cause an adverse reaction for the birth support team, the mother and her family, and most importantly, the newborn child. In order to know what an effective dose is, you have to go a little bit into pharmacokinetics, which is concerned with absorption rates, with distribution of the oil in the body, with metabolism and how drugs are excreted. You have to look at the concentration of a drug at its target site, the length of time it will typically stay in the body, which also predicts the likelihood of it having its desired therapeutic effect. All of this goes into the dosing recommendations for an oil. We believe that the therapeutic range of safe and effective oil use in birth is unique to birth, that it differs considerably from traditional aromatherapy standards, meaning even their conservative standards, even those conservative use recommendations that they have in place for sensitive populations. And that's really the heart of why this course was birthed. It was several things, but we're excited about this course because it is one of the very first, to our knowledge, the first and the only, but let's just, say for future recording sake. Depending on when you listen to this, we hope that more courses take research-based advanced aromatherapy dosing guidelines, and they do have people on board who have a midwifery grade understanding of natural or complicated labor and delivery, and we hope that they filter that through the experience of birth professionals, midwives, labor and delivery nurses, doulas. We believe that all of this should inform oil use, and these are really the three pillars that support the information in this course at Brilliant Birth Academy, is that we've taken aromatherapy standards. We've combined that with a midwifery grade understanding of a natural or complicated labor and delivery, and then we filter that through the experience of birth professionals. And so we're really excited about the dynamic nature of this course. And let's look at how this plays out practically. So when you're talking about safe oil use in birth, you have several methods of application of oils to the body. You can have topical absorption through the skin, you can have aromatic inhalation, and you can have ingestion. This is a quote from a wonderful textbook by the Price couple, Aromatherapy for Health Professionals. They say essential oils follow three main pathways to gain entry to the body: ingestion, inhalation, and absorption through the skin. Ingestion is little used. Of the two remaining pathways, inhalation is a very effective method and is indeed regarded by some as the only method truly deserving the name aromatherapy. A common trend that I have witnessed is I think the more a person studies aromatherapy and the more they study bioavailability of oils in the body, the more they tend to use inhalation over topical application. And the reasons are obvious. When you haven't studied oils and you experience an aromatic constituent, your natural response to that is to just put it all over you, is to just take it and want to put it on your hands. And yes, you smell it, but you have a sense that you're engaging more fully with the oil if you're putting it on your skin. And we have a lot of oil based products that we use as skincare products. And so my theory is that the less education a person has, and I've done informal um, polls on Facebook where I got, a couple dozen respondents. But my theory is in general that the less education you have, the more you tend to do topical application, and the more educated you are, the more you understand the power of inhalation. It's something that is very overlooked by many people who don't have the advanced training that you're receiving in this course. And I just put this quote in by very highly regarded leaders in the aromatherapy field. They're not saying that they feel this way, but this was just a quote that I saw that I pulled. They're speaking to a true trend in advanced aromatherapy studies where many people regard inhalation as really the only method truly deserving the name aromatherapy, that a topical application is not um, doesn't isn't of the same effectiveness as that. So in our academy, we do recommend a topical application for oils that are specifically intended that need to be on the skin for specific reasons, but other than that, really our default is inhalation, which is in accordance to more advanced therapeutic dosing guidelines. So let's look at topical absorption through the skin because this is what most mothers will naturally do when they have oils. If they haven't really done advanced aromatherapy training, they will just put the oils on their body. And what do? You kind of take a bottle and you put it on your skin, and what do? You rub your hands together instinctively, you smell instinctively, and maybe then you move to your arms, you rub your chest, you breathe it in again, and your belly's right there. Maybe you put it on your belly, maybe stroke it down your thighs, maybe you have a carrier oil, or maybe you don't even know that much you're putting it on neat. And so skin adverse reactions are always caused by at least one of the following errors in judgment. You can have a dose that's inappropriate, you can have the degree of absorption be affected, and then you can have a degree of reaction between the oil and immune system. Now, there are several known causes of vulnerability that increase the risk of having an adverse skin reaction, and these include the oil that's used, the total quantity of the essential oil, the concentration of the oil, and your choice of carrier, whether that's an oil, a gel, or a cream. Your vulnerability increases linearly, and it's correlated with the number of different oils that are blended and used, so you don't want to start blending a whole bunch. Before I did a lot of research, I started my research journey by reading all of the adverse reaction reports that I could get my hands on. I just read them for days, and I noticed a really high number of reports with eucalyptus blends. And so eucalyptus is an oil that increases the absorption rate of other oils. And so sometimes an oil in and of itself isn't necessarily the issue, but what it's blended with. And the fact that this is an issue is part of the reason why we have this program as it exists with the 10 best oils for birth, or you might be listening to this in the future in a different course, but in the Brilliant Birth Academy Essential Oil Consultant certification, we really want to limit, and in general, it's just wise to limit the number of oils that are used in birth that are layered. And then you have the frequency of duration and exposure. Let's look at each of these in detail. The oil that is used alone can matter. Oil composition changes absorption rates. This is based on a whole myriad of factors, including molecular weight, different properties, the how thick or thin the oil is, the polarity of it. And some essential oils, such as cinnamon bark, they're just more prone to causing allergic reactions than others. And in some cases, even a single constituent is kind of a troublemaker. And one thing that's really important to know, and this is something that you don't necessarily think of unless someone tells this to you, especially because if you're not being very careful with oils, if you just are more casual, a little bit less honoring with them, you can just have a tendency to take the top off and be dumping and blathering and using it topically, and your hands are a little oily and you're just kind of lazy with putting the top back on. It's really important that you store your oils properly, that you close the lids, the caps tightly, because oxidized essential oils are more likely to cause sensitization. So the Tisserand Institute does say that oxidized oils is a huge factor in adverse reactions. And so if you want to prevent that, you definitely want to make sure that you are not using aged or oxidized essential oils. And so these are some factors that go into the individual oil itself, like not anything else included, just that one factor. You want to make sure that you're not that you're being careful with these considerations. Next, the total quantity of the essential oil that's being used. If you lack an awareness of bioavailability timelines, this is an image from the Tisserand Institute where here you can see that we have a sharp increase of the oils being found in the bloodstream here, and you have a 20-minute peak and then up towards 30 minutes and then kind of a decline with it actively being in the body for almost an hour and a half. But if you don't have an awareness that, when you use an oil, you may not be fully experiencing those effects for up to 20 minutes, it's likely that you go back and use more of the oils because you don't understand bioavailability timelines. As we progress in this course, we have a whole series on labor stages, progression models, how to know where in the labor you are, with really amazing midwifery strategies that are going to have non-invasive, gentle, natural-based ways of telling where the mom is in labor based on things like her body posture and tonal sounds. If she has, it's called the thermometer technique, advocated by Anne Fry, that has the red line up the gluteal cleft that will tell you. And then two, you can do a fundal height assessment. We also talk about contraction and uterine tone assessments, and these will just help you to know where you are in the labor so that you can be preventative in your oil use if you want, if that's conservative and appropriate and you're not using too much. But if you, for example, you might want to use an oil preventatively if the mom says, this is my fourth birth, I start vomiting every time I go through transition, and so I want to use ginger inhalation, and we want to try and have that so that it's in her system during transition because she has a known um, response of nausea and vomiting in birth. That would be an example of when the bioavailability timelines would come into play, and knowing where you are in labor would come into play. We often have a fear that oil will not address the concern if it's serious enough. And there was this great quote, I think I share somewhere else in this course. He says, when we think of oils, we somehow think of medicine, but we also think of medical professionals who disapprove. We talk about them being very potent and things aren't safe just because they're natural, but we're afraid when confronted with a major illness that they will fail us. And, so many people are not experiencing the full effectiveness of oils because they're using them topically and because they're using them with the wrong carrier. And we're going to get into that in just a second. So a lot of vegetable oils are fixed oils. They're not ideal for optimum absorption because, as you should know by now, essential oil constituents are fat soluble. And if they are already in a lipid loving environment, they aren't going to move to a less lipid saturated environment of the skin because they're already in a fatty environment. And so what you want to do is be really careful to your choice of carrier oils. And let's go ahead and look at this really powerful information, because unless someone tells this to you, you just think, oh, I'm just going to put all my oils on my skin in fractionated coconut oil. So there's this one study, again, this is from the Tisserand Institute, and and it just really drives home the point that vegetable oils, as fixed oils, are not ideal for optimum absorption because essential oil constituents tend to stay, if they're in an oil, they tend to stay in the oil. A gel, on the other hand, is a water-based delivery system that is going to promote incredible dynamic movement of the essential oil constituents directly into the skin. This is because when you're using a gel on the skin surface now is more fatty than the gel, and your skin is rich in sebum, and this oily substance that's produced by your hair follicles is going to just soak up that essential oils, and so the essential oil is essentially attracted through passive diffusion to whatever the more oily medium is, and you want that to be your skin. Otherwise, the oil is not going to actually go into your skin. If you fast forward 4 hours, the differences from the study weren't that great, but just look at that 11.3 versus 238.5 micrograms centimeters squared after 1 hour. I mean, that's just incredible. You have a 5% dilution applied to the inner forearm. That's amazing. And so you see here that, when people are applying, part of the reason why people might be overdosing with the oils is because they lack an awareness of the bioavailability timelines because they are using a choice of carrier that is, this one right here instead of what we're training you to do, which is, able to give a real therapeutic dose. Another issue is the how thick the liquid of the oil is. That's really important. Some oils, such as hazelnut, there's just different, the size of the molecule matters with the different oils, and so the oil carrier that you use can affect the absorption rates quite a bit. Another issue is, okay, so now we're coming into another category. So the next category of known causes of vulnerability are these factors. The area of the body that the oil is applied to. This has to do with skin permeability. We have the amount of skin surface that's covered. We have the temperature of the skin, and we have the condition of the skin. So if there's inflammation, a compromised barrier function, all of these things affect oil absorption rates. So moving through these, there has been a lot of debate about ideal body locations to apply essential oils to if you want to get the best absorption into the bloodstream. And to address this question, you really need to understand how transdermal absorption happens. And our program is going to give really specific and insightful recommendation for specific application sites. And once you know this information, you'll go, oh, of course you would put it there. But, a lot of you may have heard essential oils are absorbed through the pores of the skin with no real further specification of what, quote, pores are. There are two types of opening in the skin. One is sweat glands and the other is hair follicles. Sweat glands are generally not ideal to allow the passage of essential oil constituents because sweat is mostly water and essential oils do not dissolve in water. Hair follicles are a likely route. There's some evidence that essential oils do use them as one way into our body, but research tells us that absorption really happens directly through the skin in between the cells of the stratum corneum through the lipid matrix. This is really the intercellular route that essential oils go into the body. So, for example, the soles of the feet are not really ideal for essential oil absorption outside of I think it's a Chinese philosophy of medicine that has, kind of cultural or a system of thought by which it makes sense that you would put the oils there. But in just strictly looking at absorption, I'm not discounting that at all, but I'm just saying if we're not looking at Chinese philosophy or principles of medicine, if we're just looking at absorption, you really want to think again about that application because while the feet does have plenty of sweat glands, it has no hair follicles, and the thicker skin is really hard to get through. In fact, the skin is so thick on the hands on the palmar and plantar skin sites. The epidermis is quite thick. There are no oil glands, and the time the oil takes to cross the skin is much longer. And so this is really not ideal. In fact, this area of the body of the palmar skin site is so slow with absorption that many massage therapists can use their hands to put on incredible amounts of oil on multiple clients a day and are just fine with not overdosing on the essential oils. Oil penetration it increases where the skin is thinner, and so many experienced oil using mothers will switch from applying oils to their feet, which is something that I think is taught by oil distributors and by Chinese medicine. I don't know. This is just kind of a thing that it seems like a lot of people do without really any regard to absorption rates. And so they're told, put oils on your feet. And a lot of moms in birth or in labor, they really stop putting it on their feet by experience. The reasons are kind of obvious. It's probably because they can't reach their feet very well. It's also because they have a natural intuition that they don't want to be putting an oily substance on their feet for a fear of falling. And so, in the absence of that, a lot of moms will kind of just instinctively rub oils onto their abdomen. And we're going to talk about that more in a moment, but there's certain for now, it's important that you know that the thickness and permeability of the epidermis matters, and that in many of the adverse reaction, they talked about how they, used to put their oils in different locations, but after having been pregnant and then in the birth, when the adverse reaction happened, that they were not putting oils on their feet. So the site determines absorption rates. Another thing that really matters is elevated skin temperatures, which again, you would say, obviously happens in birth. You have the rate and degree of essential oil absorption is affected here, where there's an increase in the rate of blood flow. There's an increase of absorption rates. This has been shown in studies mostly involving massage, but it completely applies to birth or inflammation. Absorption increases with skin temperature until the point of profuse sweating, at which point it drastically diminishes. And this is because when skin is hot, it's flushed, your capillaries dilate, and then as we see absorption increasing, then you have profuse sweating, and then it goes way down. So that's something that's good to remember. Oftentimes compresses are used in birth. There's the infamous rag on the head, and the reduced loss of molecules from this application site due to evaporation. Sorry, I'm reading a sentence and that doesn't really make sense. When you put a rag on the mother's head, oftentimes when you apply oils, you will lose some of the oil dose to just the oils naturally absorbing off of the mother's skin. But when you have a compress, they're obviously all locked in. The evaporation is reduced. Absorption has been shown to increase in various studies. And so the application of essential oils with water then drastically increases absorption. So the heat and the humidity of the environment in general increases absorption rates. Hydrated skin is known to be more permeable than dry skin. And if you use oils in any type of a water-based environment, you're going to have an incredible increase in absorption rates. Other things that increase absorption rates include things like the age of the skin, inflammation of the skin, compromised barrier function, such as with stretch marks and thin abdominal skin. And then skin that was recently constricted by tight clothing has also been in studies to drastically just kind of have this compromised barrier function. The oils just go in very quickly. So here, women obviously have very thin skin on their swollen pregnant belly. You also times will have stretch marks, not just on the abdomen, but on the thighs, buttocks, and just really on the arms even. You can have an incredible amount of stretch marks that present on the body. And so essential oils are going to go through that so quickly. They can cause an adverse reaction, particularly just an irritation of the stretch marks. And so often moms will again just kind of just kind of instinctively be breathing the oils and putting them on. They're oftentimes hopefully using a carrier oil, but it's so instinctive. I mean, your belly is right there. You're just rubbing it. You're rubbing up and down your thighs. You're touching yourself. And the oils can go very quickly into the mom when she's doing that. Lastly, the psychological stress of the oil user can increase absorption rates. Women have a greater list of allergic reaction to essential oils. The Tisserand Institute thinks the reasons are probably hormonal, but we've talked about in other lessons how stress can have an adverse effect on skin health. It can reduce skin barrier integrity. It also may enhance skin sensitization because of a increased activity in the immune system. And so that can affect oil absorption. Lastly, someone who has a history of allergens, skin reactions to any type of essential oils, perfumed, fragrant products may have problems with oil and birth. In our adverse reaction class, we talked about the different types of adverse reactions in skin. And we have here irritant contact dermatitis and allergic contact dermatitis, which can be a type 1 or type 4 allergic reaction. So if mothers are using oils topically, they have almost every issue in the book for why oil absorption rates would be elevated. And so because of the effect of birth on absorption rates, it's our theory that mothers may be more likely to have an oil reaction in birth, even if she is an experienced oil users oil user. And there are many textbooks that went into the cultivation of this theory. I wanted to put some up here for you that we really regard. So we're hitting close to the half an hour mark, so I'm not going to get too much into aromatic inhalation right now, but just to go quickly, the conversation as this course progresses is going to just be very dynamic and go into a lot of evidence, research-based evidence on the brain and how aroma affects the body. It affects the bodies at least 3 levels that we need to examine. The first is the chemical interaction of essential oil molecules and the neurons that lead to the perception of a smell. Then there's the link between that system and the limbic system. Then there's the psychological effects of those interactions, and that part is individual. And so while you can study the chemical constituents and you can study their effect in the brain, then you have the third dynamic element of what that smell means to a person. And so, for example, we see with patients who have dementia or Alzheimer's and who seem non-responsive with no language will suddenly light up and start singing whole ballads when music is played, because that music is stored in a different part of their brain. And you got to find a song that they like, though. So there's this really amazing YouTube video that we're going to watch, how this one nurse would just go through all this time and attention asking family members, trying to find the songs that would be meaningful to her patients. And you just see on the video, the first time I watched this video, I just cried and cried and cried, because you had people who were really restored to themselves, who previously at the beginning of the video didn't recognize their own daughter when she walked in, and then started singing these songs. And then by the end of it, you could ask them questions about the music and they would respond in full sentences. And so what that music meant to them was individual, and what oil smells mean to you and how they affect you is also something really dynamic that's so wonderful to study. And you can get into Jung and just so many different thought leaders on archetypes in the subconscious and how we store memories at a somatic level and how to minister to your body at a somatic level. And it just gets so dynamic and incredible. So I just am going to leave you with a few baseline recommendations that are very general recommendations. In general, we are in alignment with higher level aromatherapy thought that regards inhalation to be preferable over topical inhalation, topical application. And in general, in this academy, in general, we recommend personal inhalation devices over whole room diffusion. So because of this way that birth affects the topical absorption rate of oils. We do, in general, advocate the use of personal inhalation devices, and we are going to be getting into that deep deep subject of study in another course. But for now, thank you for your attention on the therapeutic range of essential oil use and birth. If you think that our work is valuable, please share it with people that you think could benefit. It's our intention to have an effective application of oils in birth, because the possibilities of how you can support and guide a labor with these plant-based natural solutions is so powerful at a level that is almost impossible to exaggerate. And yet safety is so important, and we really want to keep the whole birth team, we want to keep birth professionals safe in their fields. We want to keep the mother and her family safe, and then obviously the newborn. So thank you for your attention to this matter and for all the work that you do in helping us welcome every newborn that comes to us into a world that feels like love. I'll see you in the next course.